So you've had surgery and you're back home. Now what? First things first is the incision and the dressing. Your incision will be covered with a silver dressing. This stays in place for a week. You can shower the day after surgery. It can get wet, just let water run over it. No baths, no soaking, no pools for the next 6 weeks. After a week, you can take the dressing off yourself, or the physical therapist can take it off at physical therapy. Some of you are discharged home with what's called a wound vac. This is a special suction device which is used to help the wound heal. This cannot get wet, unfortunately. Please do not get it wet. Do not take a shower or anything like that. Either way, with the silver dressing or the wound vac, the dressings come off in 1 week. After that, you can shower as usual, but no baths, soaking, or pools for the next 6 weeks. When you take your dressing off, your incision will be covered with a special tape. These are called steri strips. Leave these in place. If they come off, don't worry about them, but leave these in place for the next 3 weeks. If they're still in place at 3 weeks, you can take them off at that time. Please do not put any salves, creams, rubs, nothing on your incision after surgery. Starting at 3 weeks, you can put vitamin E oil over the scar to help with scar healing. Put this on there 3 times a day and gently massage your scar for the next 3 weeks. If you had a knee replacement, you might notice some numbness on the outside of your skin next to the incision. This is normal, and the area will get smaller as time goes on. If you have any questions about your incision, please call the office. It's better to get out in front of a problem than be behind the 8 ball when I see you in clinic. A little bit of redness, warmth, or fever around the incision is normal. It's part of the healing process. Any sort of drainage or purulent, foul-smelling fluid is not normal. If you see a little bit of redness inside the incision, inside the dressing, that is contained within the dressing, this is normal. If any sort of blood or fluid leaks out of the dressing and down your leg or down your arm, this is not normal. Please call the office. After a week, when you take off your dressing, if you have any sort of drainage that leaks down your leg or your arm, please call the office and let us know. Again, expect some redness around the incision. This is normal. This will go away with time. Also, a low-grade fever at this time is also normal. It's a part of the healing inflammatory process. This should all get better with time. If you ever have a foul odor or discharge from your incision, please call the office and let us know. We want to know about this. All patients after having their joint replaced with me will be discharged on blood clot prevention medicine. This is extremely important. Most patients will get a baby aspirin, that's an 81 milligram aspirin, twice a day for 6 weeks. You take 1 pill in the morning and 1 pill at night. Take this every day for 6 weeks to help prevent blood clots. Some of you, for example, if you were on Eliquis or Xarelto before surgery, will get placed on a half dose of your home medicine for the next 3 weeks after surgery. After 3 weeks, you can start back on your regular dose. If you took Plavix before surgery, we want you to stop your Plavix for 3 weeks after surgery. After 3 weeks, you can get back on your regular Plavix routine. Please, please, please make sure you take your blood clot prevention medicine. This can be the difference in life or death. If you don't think you're on any sort of medicine for blood clot prevention, please call the office and let us know. After surgery, you will have some swelling and bruising. This is normal. You might have pain in your thigh after a knee replacement. You might have swelling down your arm after a shoulder replacement, or swelling and bruising down your leg after knee replacement. You might notice streaks of black and blue. This is all normal. You will have swelling. You will have some pain. This is normal. Please don't be alarmed. It is okay to shower the day after surgery if you have a silver dressing in place. If you have a wound vac, you cannot shower until the wound vac comes off. For the majority of people, you'll have a silver dressing in place. You can shower the day after surgery with this dressing in place. After a week, when the dressing comes off, you can still shower, just pat the incision dry. Speaking of showering, go ahead and get all the necessary equipment now for showering. Things like a shower chair or a non-slip bath mat. These can help you transition after having a joint replaced. For patients that have shoulder and knee replaced with me, you will be discharged home with something called a Polar Care ice pack. This is going to be your best friend. This is really going to help with the swelling and pain and inflammation after surgery. We want you to use this ice machine 30 minutes on, 30 minutes off for as long as you're awake for the first 3 weeks. This is really important. What we want you to do is get 8 regular water bottles, something you'd get from Sam's or Walmart, put them all in the freezer. Take 4 water bottles, put them in the Polar Care ice machine, fill the top with water, and run that 30 minutes on. When those are done, you can take those 4 water bottles, put them back in the freezer, and put the new ones in the freezer back in the machine. 30 minutes on, 30 minutes off for as long as you're awake. Unfortunately, if you have your knee replaced at Willis Knighton, you will not be discharged home with a Polar Care ice machine. But you can buy these online off Amazon or other websites like that. For those that are having hip replacement, please get some gel packs and ice down the front of your hip with gel packs 30 minutes on, 30 minutes off. Knee replacement patients will also use gel packs behind the knee because the Polar Care ice machine only gets the top of the knee. All patients will be discharged home with a special breathing machine called an incentive spirometer. This is extremely important to help prevent lung infection and to make sure your lungs stay healthy after surgery. To use the machine, place the device on your mouth, you put your lips around the machine, and you breathe in. The diaphragm in the machine will go up to a certain level. Do this 10 times an hour, every hour for the first week after surgery. Or I like to say, do it when you're watching TV, every commercial break. This is really going to help prevent fever the first few days after surgery. It's very important you do this for the first week. If you have your hip or knee replaced with me, you will be discharged with a walker. It's important to use this the first few weeks after surgery. Eventually, you will transition from a walker to a cane as your physical therapist directs you. It's important to use the walker the first few weeks to prevent falling. We really don't want you to fall and break something right after having your hip or knee replaced. If you have your shoulder replaced with me, you will have a sling on after surgery. Wear the sling 24/7 for the first 3 days. After this, over the next 4 weeks, you can slowly transition out of the sling. Start by stopping to wear the sling for desk activities such as reading using a laptop, and slowly wean out of the sling during the public hour. By week 4, you can totally get rid of the sling altogether. But for the first 6 weeks, we don't want you doing any sort of lifting out in space. We don't want you to lift anything heavier than a cup of coffee. And for the first 3 months, we don't want you to reach behind your back. That includes getting to your wallet or your bra strap. This will help with the healing process after shoulder replacement. We also ask that you not push up from a chair for the first 3 months after shoulder replacement surgery. This motion here, we prefer you not do after having your shoulder replaced for the first 3 months. Knee replacement patients are also asked to buy a wedge. This is used to help the healing process once you get home. We ask you to put your heels on top of the wedge anytime you're sitting on the couch resting or whenever you sleep. This will help decrease the swelling after surgery, but it will also help you heal in strict extension. We don't want you to heal with your knee flex because that is going to be how you heal long term. All patients that have hip, knee, and shoulder replaced with me need to go to physical therapy after surgery. This is extremely important. You should have your physical therapy set up by the time you leave the hospital. If you are having outpatient surgery with me, this should be set up before surgery. Please make sure you call the office to set it up. Hip replacement patients should do it once a week for 6 weeks. Knee and shoulder replacement patients should go 3 times a week for 6 weeks. Knee replacement patients, listen up. Physical therapy is extremely important. You've got to start going early and you've got to go as directed. 3 times a week for 6 weeks. Get it scheduled and go within 7 days after surgery. I prefer within 3 or 4 days after surgery. If you call the therapy office and they say they can't get you in for 20 days, call somewhere else. Do not wait 2 or 3 weeks to get going into physical therapy. You've got to start going early and often. This is the difference between a knee that you like and a knee that you love. All patients will be given a physical therapy protocol when they leave clinic after scheduling surgery. Please hold on to this and give to your physical therapist. These are the directions that we ask the therapist to follow when helping you rehab from surgery. After surgery, we ask you walk 5 to 10 minutes an hour. This helps with swelling and it also helps prevent blood clots. We ask you to use your walker the first week or 2 after surgery to help prevent falling. Your physical therapist will know and direct you when you can transition from a walker to a cane. Some of you will be discharging to home health or inpatient rehab. This is not my preference, but sometimes it's necessary. We really want to transition from home health or rehab to outpatient therapy as quickly as possible. Please, please, please try to transition to outpatient PT as fast as you can. Unfortunately, patients that go with home health or rehab sometimes have worse outcomes because of this. Speaking of home health, nursing homes, and rehab, please be your own patient advocate. I've seen too often, unfortunately, that some of these patients can get lost in the cracks. Do not let this happen to you. You've got to stay on top of them to make sure that they know when your follow-up appointment is. So often, the patients at these nursing homes assume that the nursing home will take them for their scheduled 2-week appointment. It doesn't always happen. Stay on them, be your own patient advocate, and do not get lost in the shuffle. After surgery, we want you to get back to your normal, regular life, excluding a few things. No driving for the first 4 weeks after surgery, and you cannot drive under the influence of pain pills and narcotics. No strenuous activity such as golfing for the first 6 weeks after surgery. When do we call the office? Here are a few things we'd like you to know before calling the office. A big question after surgery is fever. A fever is a 101.4 temperature or greater. If you have a fever, please call the office and let us know. But when you call, I will ask you a few things. First, if it's the first week after surgery, are you using the incentive spirometer, the breathing machine? Make sure you use that 10 times an hour every hour that you're awake for the first week after surgery. Second, all patients after surgery are discharged on Tylenol. We want you to take 1,000 milligrams of Tylenol, that's 3 pills of 325 or 2 500 pills, 1,000 milligrams of Tylenol 3 times a day, every day for 6 weeks. Please make sure you take that. If you're still having a fever after the Tylenol and using the breathing machine, please call the office. What about drainage from your incision? Again, a little bit of drainage inside the silver dressing is okay. Maybe something like the size of a quarter of redness inside the incision is fine. If you notice that there's blood leaking out from under your incision or drainage, please call the office. Also, any sort of smelly discharge or foul odor, any sort of drainage after the first week from surgery, please call the office and let us know. Some patients report bruising after surgery. This is normal. You will have some bruising. Do not be alarmed. It will go away and get better with time. Some patients complain of constipation after surgery. Unfortunately, sometimes the anesthesia putting you to sleep and the pain pills you take after surgery can cause constipation. As long as you're passing gas, I'm not too worried about it. Your body will eventually catch up and you're going to have a bowel movement. We prescribe some constipation medicine for you to take. If that's not enough, you can go buy some Miralax from the store or some magnesium citrate to help move things along. Again, this also will get better with time. Some patients have concerns for a blood clot. If you have something like calf pain, chest pain, or shortness of breath after surgery, please make sure to go to the nearest ER to get checked for a blood clot. This is very important. If you do feel the need to go to the ER and you are in the Shreveport-Bossier area, please go ahead and go to Willis Knight and Piermont. The address is 8001 Erie Drive, Shreveport, Louisiana. To watch this video again or others like it, you can Google my name, Jeffrey Pearson, MD, on YouTube to find the link. You can also find the link at the Orthopedic Specialist website. Or the easiest way is to look at the QR code on the discharge paperwork, take your iPhone, and follow the link. Thanks so much for watching.